Right now for you at 4:30, as COVID cases keep climbing, fueled, of course, by that Delta variant, there are a lot of questions about whether we need to be masking back up. You saw Shantae right there is wearing one. Or what about those booster shots to protect ourselves? The president just spoke about that moments ago. Joining us this afternoon to talk more about all of it is Dr. Lisa Kuchara, professor of biomedical sciences at Quinnipiac University. Lisa, thank you so much for being with us today.
Thank you, Eric.
Did you happen to hear the president speak? What are your thoughts about what he's saying this afternoon?
I did. I mean, the virus is nonpartisan. I think this is a great example with the details he gave of it being developed during Republican administration and now being brought out to the people during a Democratic. The virus doesn't care that we're tired of it, and the virus doesn't care who you voted for or what your political affiliations are at all.
It's interesting because I think a lot of us hear this talk about getting the shot and we're like, well, we have the shot. But I guess perhaps a role we could play would be to tell other people to get it. Is that the idea here? Maybe encourage other people to do what's right?
Absolutely. The more that your peers, your family, your friends see that you've been vaccinated and everybody around them have been vaccinated, they start to accept it a little bit more. It becomes more of the norm within, not a stranger telling you what to do or the government telling you what to do, but your family. So absolutely, if you're on social media, I've seen people change their Facebook profile and they have a frame around it, little simple things that you can do, or just saying, oh, I'm really glad that I got vaccinated. I don't want to be amongst this pandemic of the unvaccinated.
Right. And I think a reward for getting the vaccine is not having to wear a mask anymore. At least that's how it was initially presented. Yet here we are. I think there's perhaps a level of frustration with that idea. Do you see us potentially going back to masks all the time?
So it could be. We talk about a pandemic of the unvaccinated, but in some ways it's a pandemic because of the unvaccinated, right? The variants aren't happening in the air or in the water. The variants are occurring in unvaccinated people, and therefore they're now, causing us with our kind of bulletproof vest on being vaccinated to worry if that Delta variant could indeed infect us. So it very well could be that within certain areas, if our rates are high enough, we have to go back to wearing a mask again. It's one of the things that we can do, right? We still have to make sure we're washing our hands and that we're doing all the things we need to abide by to not transmit. But when we're looking at a country where only maybe 60–70% of us are vaccinated, we need to be able to make sure that we're doing everything possible to be able to stop this. As I said, we're all tired of this virus. So we all need to do whatever we can do to be able to stop this. We don't want to go backward. We see the signs, opening up again, welcome back. We want to continue that trend. We don't want to go backwards.
Boy, that is for sure. Well said. Dr. Lisa Kuchara from Quinnipiac, thank you so much for joining us again this afternoon. Always good to see you.
Thank you.